several years ago here in Battle Creek. One of the big subjects was prenatal care and the lack thereof that we had in this community. There were some huge concerns. We don't have those concerns anymore, probably thanks mostly to Bronson. And the Bronson has a team of providers in their obstetrics and gynecology specialists, and we're going to meet one of them right now that they provide a variety of services to meet the specific needs of women at every stage of life. But among the providers is Danielle Schell, a certified nurse midwife. Danielle, good morning. Nice to have you with us.
Good morning. Thanks for having me.
So you see patients at the practice as well as delivering babies at Bronson Birthplace here in Battle Creek. Where is the practice, by the way?
The practice is off of Capitol Avenue.
Capitol near what?
We are right down the road from Panera Bread.
Okay, now I know exactly where you mean. Sure.
It's south of 94.
Yep. Boy, I bet you're glad they fixed that bridge finally.
Yeah.
That had to be a hassle. I am curious what we're talking about, nurse midwife, and specifically a certified nurse midwife. What is that?
Yeah, so a certified nurse midwife is a mid-level provider that's educated through a graduate level midwifery program. This program needs to be credentialed or accredited by the Accreditation Commission of the Midwifery Education. That's also known as ACME. So a certified nurse midwife is a nurse, so somebody who's had a bachelor's degree in nursing, then goes on to receive a master's. So after the completion of that master's program, they need to pass a national certification examination that's administered by the American Midwifery Certification Board. So I think it's also important to know that certified nurse midwives, the tradition of midwifery is about helping empowering women and families to navigate through difficult transitions in their life, from start of like fertility through menopause. And then as the Pope has recently noted in his speech, that midwives actually carry out perhaps the noblest of the professions.
So if a woman is having a baby, what exactly can she expect then when she sees a midwife for her obstetrics care?
Yeah, so during prenatal care, a woman could expect to hear the baby's heartbeat. They're measured to assure that the baby's growing properly. They'll receive education on healthy diets, exercise, lifestyle during the pregnancy, and also how to sustain that through their life. They receive anticipatory guidance and education on what's happening with the baby currently and what to, like I said, anticipate with what's going to happen with the baby, as well as what to expect in her body. As a midwife, we also provide community resources for mental health, financial strains, transportation, as well as help women and families connect with support groups. And then during labor, the woman could expect labor support, choices in alternative pain management, such as walking, position changes, hydrotherapy, so like water helping with pain management, as well as hypnobirthing, which is another form of pain management. And then certified nurse midwives can also provide and they can order nitrous oxide or the pain medications. And a big misconception is that we can't, if someone's seeing a midwife, that somebody can't get an epidural, which is untrue. They absolutely can, and the certified nurse midwife can order that for them.
And you know what I'm hearing you say that maybe I didn't know or had kind of the wrong idea, Danielle, but what you're doing, it still takes advantage of the cutting edge technology, the latest techniques, the most up-to-date knowledge that you could possibly have to deliver a baby. It's not like somebody doing kind of out in the woods delivering a baby.
Yeah, absolutely. Yeah, that's a big misconception. So we are able to do everything in the hospital with the recent technology and the prescribing authority that an obstetrician would have.
Excellent. Now, how can someone schedule an appointment with you or a member of your team?
So to schedule an appointment with us, our team at Bronson Obstetrics and Gynecology Specialists in Battle Creek, we are accepting patients, and they can call 269-979-6432. And then they can also learn more about our practice by visiting bronsonhealth.com.
How long you been doing this midwifery now, Danielle?
I am currently in my 7th year of practice.
7 years. Any idea, ballpark, how many babies you've helped deliver?
Oh gosh, I should try and count that. I'm not sure, but it's close to 1,000,
Can you
if not
just
more.
can you just imagine when you get near the end of your career, and and old people will come up to you and, oh, you delivered me.
Yeah, we're having people come back that, yep, I delivered them, and now I'm going to deliver their babies.
It sounds like a very rewarding job.
It definitely is. Every day I'm thankful for what I do.
Well, Danielle Schell, we appreciate you being with us today. She's a certified nurse midwife at Bronson Obstetrics and Gynecology Specialists. Nice talking with you today.
Nice talking with you. Thank you so much for having me.